Good morning. Thank you for having me. It's very exciting for me to be able to come and share this information with you. The program started 11 years ago, or excuse me, in 2011, when we saw the first 15 people with essential tremor and did transcranial focus ultrasound. It's moving without me. Okay, thank you. So we treated the first 15 people with essential tremor at the University of Virginia. Dr. Jeff Elias, as you all know, was the person that was the pioneer here. Inside Tech has funded a 6-year follow-up study, which I was fortunate enough to be able to contact the 14 of the 15 people that were originally treated. This is the New England Journal of Medicine article from 2012, and it shows the improvement after 1 year in the treated hand tremor score of 75%. Those people were all treated in their dominant hand. The follow-up followed the same protocol. We contacted 14 people, and 13 of those were able to participate. One of the persons had expired, so obviously not contacted, but the protocol was the same. We used the same clinical rating scale for tremor, the QUEST for patient satisfaction, physical performance test, and the patient's global impression of change. There were, at the time when these people were retested, 3 of them had had DBS procedures. So they were tested after 12 hours off the DBS. And a weakness of this protocol, obviously, is that there was an unblinded assessor, me. So I wanted to show you these drawings, both treated and untreated hands, as a little bit of a picture of, even though the assessment was unblinded, it's pretty obvious between the best and the worst, anyway, as far as what the treated hand looked like, and in both those scenarios. So this group had a sustained improvement, aggregate improvement of 36%, with a 22% worsening of their untreated side. So despite the obvious disease progression, there was still a 36% retain. The individual hand scores are over here on the right, and this is picked up from the plot that was published in the original pilot study with the progression over time. And at the 1-year point, those were the ones in the original pilot study. That was the last time point assessed. And you can see on the bottom that there's 3 people that are very low tremor scores, and there's 3 people at the top that essentially no longer had effective treatment. 2 of those were 2 of the individuals with the bilateral deep brain stimulation. The 3rd one is the person that was the worst score at 1 year and did not have any subsequent treatment. Overall, I think it's really exciting that 6 of the 13 still had a greater than 50% improvement. The disability scores rated by the functional outcomes in the clinical rating score for tremor were sustained at 50% average. We have pretty strict criteria that we're using on the right-hand side, where we're looking at individual scores, specifically at primary tasks, and we're trying to identify responders and non-responders. And our initial baseline assessments, 100% had difficulty with eating and drinking and had non-functional writing. The 0 to 1 score really is a normal or next to normal rating. So this is pretty strict criteria. People were included in this initial trial if they had a score of 2 or more on 2 or more of the 8 in ADL scores. So at 1 year, you can see that what the efficacy was retained, and even at 6 years, we have between 46 to 62% sustained with these individuals. They were still pleased with their outcomes as rated by the quality of life in essential tremor, and the global impression of change score, 87% report, or 85% reported being better than before their treatment. How's that for 5 minutes?
Perfect. Great way to start. Thank you. And now we're open for questions.
Yes.
I'm Dr. Chung from Korea. Thank you for your presentation. And you didn't show the result in the 2 years, 3 years, and 4 years. So I also recently analyzed my data in 4 years, and we have a relatively stable improvement. So when did you see the rapid, the worsening of the symptoms in between 1 and 6 years?
We did not see these people since year 1. The original protocol was actually a 3-month protocol because the primary outcome for the first pilot was efficacy, was not efficacy, it was for safety. So we were looking at avoiding adverse events and whether the treatment would even affect the tremor at all. So the original plan was to end at 3 months. We decided 1 year would be better, so we asked them back and they were consented for one more, or for that first year, but we have not seen any of them on follow-up until this 6 years. So we have no time points in between to share with you.
So in my experience, some of the patients who had the recurrence show the worsening of the symptom at 2 years follow-up, and you can compare. And also the another question is, did you compare the volume of the region with good outcome and bad outcome?
I'm sorry, can you repeat that?
Did you compare the region volume?
No, we didn't. We don't have follow-up studies on these, any imaging studies on these folks at 6 years. But yes, we are looking back at the 3-year is the last study we have. So we are looking back at the 3-year information and comparing it to what we know now with additional protocols and the information with the skull density ratio and looking at various aspects. So this is the first wash of what we've found as far as what their effectiveness still is.
Thank you.
I just have a quick question. In your quality of life and all the other measures, did that include the DBS patients? And if you exclude them, how does it hold up?
So the DBS patients rated themselves without the DBS and with the DBS. And all of the information reported here is without DBS.
Right, but if you take, I mean, that's a little bit tough. Right, so if you take those 3 patients out, how does your data hold up?
It's very well. The 2 people that had DBS were at the top of being unsatisfied.
Okay.
That's why they had the DBS. One person was, at 1 year, had great sustain, and sometime between the 1 and 6 year, really lost efficacy and developed vocal tremor and head tremor, and got good results with her DBS. The other person did not have good results with his DBS. I'm not sure why.
And just to follow up on what John Wu was asking, Travis Tierney from Miami, you do have the data on the original thalamotomies, and I think that your outcomes at 6 years are actually pretty good, given that these were the very first ones that were ever done, and we didn't know how hard to burn these. But was there a real difference in those 6 patients that had sustained responses versus the other patients that may have not? For example, was there a deep core that was seen on those original MRs at 24 hours versus the other ones that are not? I mean, do we have a radiological correlate for that in those older patients?
We're looking into that. I can't react to that right now, but that's being explored, certainly.
Thanks.
Yeah.